Awesome. We are live. Only a couple minutes early, I guess 1 minute early now. So I'm just going to wait a few minutes, see if anybody else hops on, and see if Dr. Ercia joins us too. All right. If you're watching the replay, thank you for taking the time. This is going to be a really great conversation. Oh, she joined. Okay. How do I go live? All right, just waiting for her to hop on with us. Yay!
Hi.
How are you doing?
I'm great. I love all your Christmas in the background.
Thanks.
How fun.
Like, gotta have the tree.
Yes. I know you know that I'm moving right now, so I'm like so excited just to get in the house and decorate at least a little bit for the holidays.
That's awesome. That's so exciting, and I'm sure very stressful.
Yes.
Congratulations.
Actually, thank you. As soon as I leave here, I'm going to run to the title and sign. So
woohoo! That's exciting. Very, very cool.
Yes.
Awesome. Well, real quick, let me just do a quick introduction. So hello. For those of you who don't know me, my name's Nicole. I'm a massage therapist with Massage Mobile. We've got Dr. Ercia here with us. And she's going to be speaking with us a little bit about what it is that she does. She's a doctor of physical therapy, a little bit about her business, and just some great items and things, maybe some tips, stretches, things like that. So I'm really excited to have her. So Dr. Ercia, why don't you tell us a little bit about what it is that you do, a little bit about your business?
Yes, I'd love to. Thank you so much for having me. I am so grateful for you and your platform. Thanks for sharing. But I am Dr. Ercia Parazo. I'm a physical therapist here in San Antonio, Texas. And I'm going to rewind a little bit and tell you a little bit about my background. I graduated from the University of Texas, San Antonio, so UTSA, with my Bachelor's of Science in Kinesiology. So that's essentially the study of movement and physical activity. So after that, a couple years later, I moved halfway across the nation to Orlando, Florida, and got my doctorate in physical therapy. And then as soon as I was done, I came back to Texas and tacos, and I've been here ever since.
Awesome.
So, yeah. So I started working in outpatient physical therapy and, kind of developed a love for treating older adults. So I started my own private practice. I now own and operate Fortify Physical Therapy and Wellness, which again treats patients in an outpatient capacity, but instead of people coming to me in the clinic, I get to come to them. So I know you kind of do some mobile work as well, which I love. That's why I love being with you and on your platform, because we have some similarities in that respect. So I was looking at an interview that you did previously and kind of the reasons why you got into mobile practice, and I can absolutely relate to that.
That's awesome. Well, great. That's awesome. So are you only treating patients who are older or elderly, or do you work with patients who are younger as well?
Thanks for asking. So I treat older adult athletes in Fortify Physical Therapy and Wellness, but I also treat people younger than 65 because a lot of the work that I do is preventative in nature. So I've seen things over the years since I've been in practice that could totally be prevented if they just knew kind of what to do and how to prevent it. So I started doing that as well. So I absolutely treat people younger than 65 or that don't consider themselves old.
That's awesome.
Yeah.
Age is but a number.
Absolutely. Oh my gosh. And a lot of the things that you'll see on my platform have to do with kind of breaking down stereotypes associated with aging, because that negatively impacts us over time as well. So you'll see a lot of the information that I share is things positive about growing old.
Yeah, and I love that. She does do a lot of great like educational things and videos, which of course I love. And so just good information. So if you do get the opportunity, go follow her and like her page. She's really great. So real quick too, for those of you who aren't familiar, can you tell us a little bit about what physical therapy is, how it's different from body work like massage or chiropractic work or, things like that?
Yes. So physical therapists I pull this straight from the vision statement of the American Physical Therapy Association because it's just very succinct and it embodies everything that we do and believe in. So our vision for the profession is to transform society by optimizing movement to improve the human experience. So I wanted to kind of break that down into little pieces. The first part of that, transforming society, is just what we are in this profession for. So we take our clients and our patients' goals into mind when we make our plans of care. So anything that they're having trouble with or is negatively impacting their lives, we'll try to address. So I've had people that have back pain that can't bend down to pick up their grandchildren, or people in the hospital when I was in clinicals that couldn't even sit up on the edge of the bed to hug their wives or to give their kids a kiss. People that are so afraid to fall that they can't get up to get to the bathroom, so they hold it for so long that they end up getting the bed. So things like that truly negatively impact people's lives is what we're here to address. And we do that by optimizing movement. So we find things that are we identify things and address things and prevent things that could negatively impact movement. And how is it different from other body work? You said like massage and chiro. I do want to point out that there is some overlap between our professions. So we might, well, an outpatient physical therapy at least. So a physical therapist might prescribe a hip flexor stretch or do hip flexor flexibility with a patient. And that's because, I've done a differential diagnosis for somebody's low back pain and determined that it's caused by some spinal stenosis, so closing of the lumbar spine, that they've been bent forward for so long because that's just a more comfortable position and their hip flexors got tight. So while I might be prescribing a hip flexor stretch because of that, a massage therapist or, another practitioner, not necessarily one of us, could be prescribing that because, they just see that their hip flexor is tight. And both of those are great reasons to do a hip flexor stretch. It's a little bit different as to why we do it. Yeah. Same with chiropractic. They do a lot of manual work. And physical therapists can do manual work as well, but our why can sometimes be a little bit different. And like you mentioned, all of us play a role in educating our clients and patients. So there is a little bit of overlap between the two professions, but again, there sometimes is a difference to our why. And then physical therapists can be found in a lot of different settings. So there's me in the outpatient capacity that you'll just go visit at an office, or I, for instance, will come to your home. But physical therapists can also be found throughout the continuum of care. So from acute care in the hospital, inpatient care, in a skilled nursing home, we play roles and treat patients in palliative care and hospice. So you can find us kind of all over the place as well. So a lot of people, when they think of physical therapy, think about like, oh, I'm going to go to the clinic and, adjust my knee pain. But, sometimes they don't know because they haven't needed us in a hospital, and hopefully never will. Right.
Yeah. And it's so interesting because I don't know why, but I've been attracting all kinds of physical therapists lately. Oh, nice. Like as clients or like, just people I've met like you, and you guys all work in different areas, and it's really interesting. And the other thing I really like too that you said is that it's important to hear it from different practitioners, because I think it helps to instill into that client or into that patient like, oh crap, yes, I am, tight here, or I do need to do this. And getting it from all sides, I think is going to be better for that person, so that it helps them, through their wellness journey, whatever that may be. But absolutely right. So why would somebody receive physical therapy? You kind of, talked about the locations that PTs are at, but like what is the reason for somebody? I mean, do you have to just be injured, or are there certain conditions, that was more prevalent that you're seeing? That makes sense.
Yes, absolutely. So again, there's so many different settings that we're in. So there's a lot of different things that a physical therapist can treat. And then I'll touch a little bit on what I see a little more often. So we see patients after neurological events. So like stroke or a total brain injury after a car accident, spinal cord injury after motorcycle accidents. I have a patient right now with multiple sclerosis. So we see people as soon as those events happen and then kind of stick with them throughout the continuum of care. So while someone, a colleague might see somebody for one of those conditions in the hospital, I might see them, 5 years later for the same diagnosis, but at a different kind of level in their care. I personally see a lot of people with osteoarthritis that is contributing to their pain, low back pain, neck pain, and shoulder stuff is kind of what I see a lot of. And that's because those are just more prevalent in the older adult population. But I also see sports injuries because I'm treating older adult athletes. So a lot of the things that you see with your younger athlete, I'll see with my older adults, which is really fun. But you don't necessarily have to be suffering from something to see a physical therapist. So, like I mentioned previously, I see kind of things that over time will contribute to knee pain while somebody is playing tennis, or will contribute to just decreased performance over time in that patient's sport. So addressing those things and kind of nipping it in the bud before it's an issue is something that I'm doing with Fortify Physical Therapy and Wellness.
Yeah, I think that's really important too, because I see a lot of people, I work mostly with pre and postnatal women, but I do have my chunk of athletes, and they put their body through so much. And I'm like, oh my gosh, what is this going to be like when you're older?
Right.
And I get people who come in with all different kinds of injuries, and, obviously that's outside my scope. So just helping them through the pain, but also having somebody to refer out to, like yourself, is, I think, really, really great to have, because you do know how to address that issue so that as they do age, it's not going to hopefully affect them, and they can continue doing their, athletic program, whatever that is, for longer periods of time. Go ahead.
Yeah. And for a lot of them, it's like they're so motivated to continue doing that sport and performing at their highest level that they'll do, what I tell them is necessary to continue in sport, but oftentimes they didn't know.
Yeah. And I've had, somebody just yesterday was just mentioning how, they couldn't even, their sink was broken. They couldn't even get underneath the sink. And he's just like, man, I put that sink in, like, I can't even go and fix it now. And, it's because you age. It's just what happens.
Right. Things change. And if we're not actively addressing them over time, they just kind of get worse. And that's not everything. I don't want to just make it seem like getting old is getting worse. But true. There are changes in our strength and tissues and flexibility that just change, and we have to do a few things to just address that so that we can continue kind of doing things under the sink, right? Like we did 10 years ago.
Exactly. Awesome. Well, how do you, and you may or may not work with other massage therapists, I'm not sure, but how do you see, or how does physical therapy and massage work together?
So I don't directly work with a massage therapist, but I refer out to massage therapists all the time. And I have patients that just before they even come see me are already seeing massage therapists. And I've seen it be beneficial a lot with the psychological component. So sometimes if I'm in clinic or if I meet somebody at a tennis court, it's not necessarily the most relaxing environment, right? So when people get to be with a massage therapist and spend that hour and incorporate breath work, in addition to all the manual work that they do, that can have a huge impact on pain. Huge. So, I mean, yes, we treat physical things as physical therapists, but it's important to also note that there are psychological, like mindful things that need to be addressed, because pain is multifaceted and multifactorial. So I've seen that be a huge benefit. But also patients, not just with massage therapy, but are seeing me, a massage therapist and a chiropractor, and patients that have that team of people communicating and all working towards the same goal and helping that patient, achieve what they want to achieve are better off than the patients that, just have fewer people on their healthcare team. if that makes sense.
No, it does. And I think that's really important too, which is, why I'm so happy that you've reached out to me. And, I have other like chiropractors or acupuncturists, like all these people to talk to, and we generally work with the same person. It's nice to have that communication. Oftentimes I'll tell a client, hey, talk to your chiro or talk to your physical therapist, ask them what it is that they want me to focus on, so that we are all working towards the same goal, so that this person can get healthier more efficiently. So that's great. And, for any patients or clients listening, and you do have a team of people, don't be afraid to ask them, hey, can you guys talk to one another? And I'm sure there's HIPAA regulations and things like that in place, but you can always talk to your provider about what that looks like, so that those teams of people can work together, so that you do have better care and you get better quicker. So that's awesome. So one thing I did have a question on, because I'm just so curious. I know what my setup looks like, but as a mobile physical therapist, what does that look like? What does the session look like? Does the client need to have certain items or equipment available, or is it something that you bring, or do you even need something like that?
So one thing I love about physical therapy is the creativity kind of involved. So sometimes I'll develop a plan of care. I know what the patient needs to do, but then if they don't have the equipment, or if I don't have the exact equipment, we just get creative and kind of make our own. So typically I'll arrive at a patient's home. I'll just ask for a clear kind of like 5x5 space that I can set up my physical therapy or massage table. Essentially, it's actually right here next to me. Right. So just a little space that we can have to work with. And then, animals in a separate room, so that it can just be kind of us in there and focused on doing what we need to do. I have a lot of exercise equipment that I can bring, and I will bring. And then sometimes if a patient does have exercise equipment, we work with that as well, because sometimes I'll be prescribing a home exercise program for them to do when they're not in physical therapy with me. And it's important that we use what they have, so that they're not using something that I have that's completely different than what they have, so that we're training with what they're going to be using when I'm not there. So it's a combination of things. I bring what I have. We use what they have sometimes, especially if it's something I'm going to prescribe for a home exercise program. And then we can get creative with things around the house as well.
Yeah, that's so funny, because there's a fitness professional that I also recommend and refer people out to, and she has all these videos, because she works mostly with moms, and she's like, even if you don't have dumbbells, get jugs of water, like
yes.
Get a laundry detergent bottle, and it is awesome that you guys can be so creative, because not everybody has even the resources to get the equipment that they may necessarily need, and getting creative like that, using things around the home, I think is so important, so that there is no, for lack of a better phrase, no excuse not to do the work that you need to do to get better. So
yeah,
awesome.
I had somebody, I posted something on my story, like, who's your favorite workout buddy? And someone sent me a message like, it's my grandkids, and then sent me a video of her with the little toddler on her legs, and she was doing 20-pound leg presses with the baby.
Listen, the kids can get heavy.
Oh my gosh, yeah. I have a 1.5-year-old niece now, and I bend down to pick her up now. I'm like, oh my goodness, I'm gonna need to do some squats.
That's funny. Awesome. Well, I know we had asked some people for questions, so questions from the audience. So did you get questions on your end from people?
Yes, I had one, and I think we kind of talked about it a little bit already. It was, what does preventative physical therapy look like? So that's just having a discussion with a client or patient that kind of communicates what they want their lives to look like in 10 years. Do they still want to be hiking? Do they still want to be running around with their children? Are they going to have more children? What that looks like, what their goals are, and do they want that to be completely pain-free? Some people are okay with a little bit of pain and bones cracking and stuff. Others want to be completely pain-free. Some people are okay with their performance in sport declining a little bit. Others want to perform exactly the way they're performing now in 10 years. So I have that discussion with my patients, and then we make goals based on that. So preventative care looks different depending on the patient, because everybody's goals are a little bit different.
Yeah, and that's always a conversation, of course, they have more with you or with whoever they're with. I did get a couple questions. I was just pulling them up. So one question was, my knee is clicking. Is this a problem? Girl, my knees click all the time.
Right? Like every time I bend down, my knees clicking. It can be, or it might not be. So sometimes we'll get some clicking and popping, and it's benign. So if you're not experiencing any pain with that, typically it's okay. But it's important kind of to have a discussion with your healthcare provider, whether that be your primary care physician or me, a physical therapist, because sometimes it could be an indication of something different. So for instance, there's, a tendon on the side of your leg that sometimes clicks and pops over a bone. That might be something that you need to address because it can be painful. The meniscus, which is some cartilage in your knee, could also cause some clicking and popping in addition to other symptoms. So that might be something that you wanted to address. But then sometimes if you just have osteoarthritis and it's not painful, it's fine. Or if you just had a total knee replacement and you're bending your knee and you hear some cracking or popping, that might just be your scar tissue breaking up, which is fine and expected. So it's definitely important to, have a discussion on what your popping looks like, just in case it's something you're going to want to address, or maybe it's benign and it's fine. But I do offer, complimentary consultations. So if that's a discussion you wanted to have with me, just feel free to direct message me.
Yeah, that's awesome. I didn't know that. Very good to know.
Yeah.
Love it. The next question we had was how to gain more mobility with hip flexors.
Okay. Oh, I feel like I coincidentally mentioned hip flexors a second ago. I love it.
Yeah.
So I want to distinguish kind of between the difference of like hip flexor flexibility and then hip mobility that's limiting your hip flexion. So if the muscle's tight and just need some flexibility, there's some hip flexor exercises or stretches that you could do. But if the joint mobility, it's what's limiting your motion, then there are different things to do. So actually, I think a good idea would be after we hop off this live, I'll kind of post in my stories a few different variations of hip flexor muscle stretches, and then a couple of things that you could do if your hip joint mobility is what's giving you an issue. So different things you can do depending on what kind of your goal is, but all things that you can do and address, which is great.
Yeah, awesome. So yeah, if you guys are interested in that, make sure that you hop on her stories. Give her a few minutes to actually do it, but hop on her stories and check it out.
Yeah, maybe after I sign for closing.
Yeah, there you go. Oh yeah, she's got a house to close on. That's awesome.
Yeah.
And then, so the last thing is, are there any like common things that you are seeing that you can give our audience some tips on to help prevent those issues in the future? Or are there any like exercises or stretches or anything that you just want us to know or be aware of that, people who are watching can do this now, today?
Mm-hmm. So just generally, for 75 or more % of the things that I see is exercise, just general exercise, not structured like physical therapy stuff, just exercising and physical activity in general could help to prevent so many things that I see. And especially right now with the COVID-19 pandemic, exercise and movement is the one thing that I think is most important. So of course, boost your vitamin C, do what you need to do to boost your immune system. But one thing I don't see people talking about is exercise and movement and how that can play a preventative role, not just in, all the other things I see, osteoarthritis, back pain, neck pain, knee pain, shoulder pain, but also could boost your immune system and make you, make you stronger during this pandemic. So, I thought a lot about this, like, what can I give somebody to do? And really it's move. So it doesn't matter where you move, doesn't matter when you move, just move. It doesn't matter what your exercise looks like. So the World Health Organization actually, like a month ago, just published new physical activity guidelines. And they recommend at least 150 minutes per week of moderate to vigorous intensity exercise. So 150 to 300 minutes, which sounds overwhelming, kind of sounds like a lot. But you can break it down into 10-minute bouts. So just start with, if you're not exercising at all right now, just start with 10 minutes of movement. 10 minutes walking to the mailbox and back. I guarantee you it's better than nothing, and you're doing things to prevent things that you don't want later on in life.
Yeah, and I know sometimes that mental struggle can be hard. Like, oh, if I don't get 30 minutes or an hour of a workout, what's the point? But you're right. Break it up throughout the day, because something is better than nothing. And if that prevents you from having certain issues as we age, like, why wouldn't you want to do it? It's just making that commitment to yourself and to your future that I think can be tough. But just do it. Just do
it.
Yeah,
and I like that you mentioned that there are things, sometimes barriers that are really hard to get around. So depression, some people that are depressed, it's hard to get out of bed. But even just sitting up in bed versus laying down, you're spending more energy than you would just laying down. So, just little things like that, little small manageable steps are better than, nothing.
Yeah, and it's always something that you can build on towards the future, but just do something.
Yes, yes.
Well, this is great. Thank you so much for talking with us and taking the time, and so excited that you gave us the time. I really appreciate it.
Thank you. I appreciate you, and everybody keep an eye out for those stretches. I'll post them here in just a little while.
Yes. So real quick too, are there any other ways that people can connect with you? Because here's the thing, she may have a passion with working with older adults, but she does work with a wide variety of people. So, or you may have a person or a loved one that, could benefit from Dr. Ercia. So please let us know how we can connect with you, whether a phone number, email, or, just through the Instagram. What do you prefer? What are your ways to connect?
Sure. Any of those are okay. You can direct message me on Instagram at Fortify PT and Wellness. You can email me, fortifyptandwellness@gmail.com. Those are probably the best two ways right now. If anybody has any web design experience, that'd be great too, because I'm working on a website, but it's so overwhelming.
Yes.
And it's a bigger project than I expected. So website coming soon, but right now Instagram and Gmail are the best ways.
Awesome. Well, thank you again. I hope you have wonderful holidays. Good luck with the closing of your house. I'm excited for you.
Thank you so much.
Yes. Thank you for joining us. I will see you guys later. Bye.
Bye. Thank you.